Welcome to the International News Channel, News LD. Today we present to you a news entitled,
COVID no longer a global health emergency, World Health Organization says. World Health Organization, WHO, officers have stated COVID is no longer a global health emergency, marking a symbolic finish to the pandemic. It is with nice hope that I declare COVID-19 over as a global health emergency, WHO Director Normal Tedros Adhanom Ghebreyesus stated. That doesn't imply COVID-19 is over as a global health risk. COVID-19 has modified our world and it has modified us, he stated, warning that the chance of recent variants nonetheless remained. The pandemic had been on a downward development for greater than 12 months, he stated, acknowledging that the majority international locations have already returned to life earlier than COVID. Learn extra. COVID could no longer be a global health emergency, however virus hasn't disappeared to the background. The NHS COVID app is closing down, however is the pandemic actually over? COVID vaccines may have hyperlinks with inflicting tinnitus as new theories emerge. Mr. Adhanom Ghebreyesus additionally highlighted the harm that COVID had performed to the global neighborhood, saying the virus had shattered companies and plunged thousands and thousands into poverty. WHO made its resolution to decrease its highest degree of alert after convening a knowledgeable group on Thursday. The UN company does not declare pandemics, however first used the time period to explain the outbreak in March 2020, lengthy after many different scientists had stated a pandemic was already underneath means, in could final 12 months. WHO consultants stated the tip of the pandemic was in sight, publishing coverage briefs for governments to observe on an infection management, testing, vaccination and misinformation. Final month. The NHS COVID app was switched off and shall be discontinued fully on 16 could. COVID could no longer be a global health emergency, however virus hasn't disappeared. Tom Clark, Science and Expertise Editor, at A. Tom Clark. The declaration that COVID is no longer a global health emergency is an historic second. It may be seen as an official declaration of the tip of a pandemic that in 3 years killed almost 7 million folks globally and made billions sick. In itself, it's a bureaucratic step. When the WHO declares a public health emergency of worldwide concern, it requires international locations to formally report statistics, take steps to guard residents and travelers, and conduct surveillance for the virus. For a lot of international locations, such because the UK, the choice will make little distinction to what we have been doing anyway. However, in locations with poorly resourced healthcare programs, it may release capability to take care of the opposite main illness threats together with tuberculosis, HIV and malaria, which have continued all through the pandemic. 650,000 folks alone died with HIV in 2021. The identical month, the Workplace for Nationwide Statistics stated that COVID was no longer a prime main reason for demise in England and Wales. Professor Susan Hopkins, Chief Medical Advisor on the UK Health Safety Company, stated, the World Health Organization's transfer to finish COVID-19 as a public health emergency of worldwide concern, is due to efficient vaccinations and coverings which have tremendously decreased the chance of extreme illness and demise from an infection around the globe. Thanks to those health interventions, we have now already transitioned to dwelling with COVID-19 in England. However, we proceed to watch the virus via our array of surveillance programs and genomics capabilities and stand ready to reply if the chance will increase sooner or later. COVID was declared a pandemic on March 11, 2020, triggering lockdowns and journey restrictions internationally. There have been greater than 6 million COVID-related deaths worldwide since then. The virus has triggered an estimated 764 million instances globally and about 5 billion folks have obtained no less than one dose of vaccine.